Hi guys, today I will be presenting type 2 diabetes. My goal today is to explain what type 2 diabetes is, how it affects the body, and most importantly, how it impacts dental care. So why I chose diabetes type 2 specifically. I chose type 2 diabetes because it's a good condition. It's a condition that affects people close to me, including several family members, specifically my grandpa. I lived with my grandparents growing up, and I would always watch my grandpa have to prick his finger to check his glucose levels, and I was always interested in that when I was a child. Um, and the more I learn about diabetes, the more I realized how connected it is to oral health, especially periodontal disease. I wanted a better understanding of this condition so I can provide the care to my future patients. Growing up, my family didn't have the knowledge of knowing about diabetes. And now that I'm older and can do my own research about it, I thought I would pick type 2 diabetes so that I can educate myself and educate my future patients. So, what is type 2 diabetes? Diabetes is a chronic metabolic disorder. It occurs when the body becomes resistant to insulin or when the pancreas doesn't make enough insulin to control blood glucose. This causes blood sugar levels to remain elevated for long periods, which can lead to damage throughout the body. So, incidence and prevalence. Type 2 diabetes is one of the most common forms of diabetes, accounting for about 95% of all cases. While it's more common in older adults, but we are now seeing it more often in younger people due to rising obesity rates. Certain groups like American Indians, Latinos, African Americans, and Asians have a higher um, prevalence, although it is not entirely linked to race. So for etiology, there are multiple causes, but the strongest connections are lifestyle and environmental factors. Obesity is the biggest predictor because excess fat increases insulin resistance. As your blood sugar rises, the pancreas produces more insulin until it becomes overworked. Etiology part 2. So, some other risk factors include a sedentary lifestyle, being overweight, family history, and ages over 40. Genetics can contribute, but type 2 diabetes is more often related to long-term lifestyle patterns. Right, so in type 2 diabetes, the pancreas tries to keep up with high glucose levels by producing more insulin. Over time, the beta cells become fatigued and can't keep up. Chronic high blood pressure leads to vascular damage, nerve damage, and inflammation throughout the body. Some major complications of type 2 diabetes include cardiovascular disease, which is the leading cause of death in people with type 2 diabetes. Other complications include kidney disease, neuropathy, eye damage, and delayed wound healing. These systemic complications reinforce why diagnosis and management are so important to catch it early. Some common signs and symptoms of type 2 diabetes is increased thirst, frequent urination, fatigue, blurred vision, and slow healing wounds. Some individuals may also have recurrent infections or numbness in their hands and feet. However, many early cases have no noticeable symptoms. Or clinical manifestations include systemic symptoms and effects on multiple organs. Depending on the severity, patients may show skin changes, delayed wound healing, weight gain or weight loss, and systemic inflammation. But symptoms vary widely among patients. For diagnosing type 2 diabetes, usually involves blood testing. An A1C of 6.5% or higher confirms diabetes. A fasting glucose of 126 milligrams per deciliter or higher is also diagnostic. Other tests include the oral glucose tolerance test and random glucose tests when symptoms are present. As far as medical management for type 2 diabetes, it is generally not curable except through a pancreas transplantation, but it is very manageable. Treatment focuses on lowering blood pressure or lowering blood sugar and preventing complications. Lifestyle changes will help manage type 2 diabetes, such as improving your diet, exercising, and weight loss. And those are usually the first steps into managing type 2 diabetes. Many patients require medication to maintain glycemic control. This will be step 2 after trying to manage lifestyle changes. This is when medication will come into play. This can include oral medication, insulin therapy, or a combination of both, but the goal is to keep blood sugar levels stable and protect the organs from long-term damage. Some common medications used to control type 2 diabetes is metformin, which decreases glucose production by the liver. Another one is SGLT2 inhibitors, which reduce glucose absorption by the kidneys and help lower blood pressure. Other medications help increase insulin secretion or improve insulin sensitivity. Oral manifestations. Type 2 diabetes has major effects in the oral cavity. Some common problems include dry mouth, fungal infections, increased caries, burning mouth symptoms, and delayed wound healings. And actually, one of the most significant findings is an increased risk of periodontal disease, especially when blood sugar is poorly controlled. For dental management with type 2 diabetes, as a hygienist, it's essential that we take extra precautions with diabetic patients. We need to make sure that their blood sugar is stable before treatment and to review their most recent A1C. Morning appointments are preferred and recommended because blood sugar is usually more stable. And then just to confirm that the patient has eaten and taken their medication that day. And here's my reference sheet. Thank you for listening to my presentation on type 2 diabetes. Understanding this condition is key to early prevention and better outcomes to your future patient.